This is the Part 8 of the RA 9173 Law Lecture. This is the last part of this lecture series. Let us talk about the Article 5 of the RA 9173 Law, which is about nursing education. Section 25 is about the nursing education program. The nursing education program, according to the law, shall provide sound general and professional foundation for the practice of nursing. The degree that is required to become a nurse is the Bachelor of Science in Nursing. This is conferred upon completion of at least 4 years nursing program offered by a college, professional institution, or university duly recognized by the Commission on Higher Education. The latest BSN curriculum that is prescribed and promulgated by the Commission on Higher Education is CMO 15 of 2017. These policies, standards, and guidelines implements the shift from competency-based standards to outcomes-based education. It also specifies the core competencies that every Bachelor of Science in Nursing graduate must have. Section 26 is about the requirement for returning inactive nurses. So what is an inactive nurse? An inactive nurse is a registered nurse who have at least 5 years consecutive inactivity in the practice of the nursing profession. This nurse cannot just immediately go back to practice the profession if he or she wants to, as according to the law. Before she can be allowed to practice the profession, this particular nurse must first undergo 1 month didactic training and 3 months practicum in a hospital that is accredited by the board. So my tip for you is, if you have the license, practice the profession. Use it. Huwag mong sayangin yung pinaghirapan mo ng 4 na taon sa College of Nursing at yung pangmalakasang review na ginawa mo para pumasa sa board exam. If not, you will be considered to be an active nurse if you did not practice your profession for 5 consecutive years or longer, and you will be required by the law to undergo 1 month didactic training and 3 months practicum, at may bayad ulit yun. Section 27 talks about the qualifications to be a nurse academician. The first one is that obviously, one must be a registered nurse in the Philippines. In addition to this, he must have a master's degree in nursing, education, or other allied health sciences. The law also requires the nursing faculty to have at least 1 year of clinical practice in a field of specialization. Lastly, all nurse educators must be a member of good standing of the Philippine Nurse Association. Now let us compare the qualifications of a faculty member to the qualifications of the Dean of the College of Nursing. The Dean of the College of Nursing must be a registered nurse, and it is a must that the Dean have a master's degree in nursing. Of course, Deans must also be a member of the PNA and must have at least 5 years experience. The next is Article 6, or nursing practice. Section 28 talks about the scope of nursing. Nurses can practice the profession either as an independent practitioner or in collaboration with a health team. As independent practitioners, nurses practice the profession in the primary level of care, that is, health promotion and illness prevention. On the other hand, as a member of the health team, nurses perform nursing care from the primary to the tertiary level of care, in collaboration with other members of the health team. This includes curative, preventive, rehabilitative aspects of care, restoration of health, alleviation of suffering, and when recovery is not possible, towards a peaceful death. Either practicing independently or in collaboration with other members of the health team, nurses deliver nursing care services to individuals, families, and communities in any healthcare setting. And this involves delivery of nursing care during conception, labor, delivery, infancy, toddlerhood years, preschool to school age, adolescence, adulthood, and old age. Or as they say, nurses deliver nursing care from womb to tomb. Section 28 talks about the scope of nursing. According to this section, it is the duty of the nurse to provide nursing care using traditional and innovative approaches, such as healthcare techniques and procedures, essential primary healthcare, the administration of written prescriptions for treatment and therapies, oral, topical, and parenteral medications, internal exam during labor in the absence of antenatal bleeding and delivery, therapeutic use of self, health teachings and comfort measures. And according to the law, suturing of perineal laceration requires special training. And according to this law as well, there is no training that is required for a nurse to be able to administer intravenous therapy medications. And aside from providing nursing care, it is also the nurse's responsibility to teach, guide, and supervise nursing students. And lastly, nurses must undertake trainings and research. Section 29 speaks about the qualifications of nursing service administrators. Nurse supervisors or managers are required to be a registered nurse with at least 9 units in management and administration, 2 years experience in general nursing service administration, and a member of the PNA. This is also the qualification of chief nurses for primary hospitals. For chief nurses or nursing service directors in secondary to tertiary level hospitals, the requirements include the first 3 that are mentioned previously, plus 5 years experience as a nursing supervisor or manager, and a master's degree in nursing. The requirements is also the same for chief nurses in the military hospitals. However, the law says that those applicants who have completed the General Staff Course or GSC should be given priority. For chief nurses in public health agencies, the requirements are still the same. But the law also states that those who have master's degree in public health or major in community health nursing should be given a priority. Section 32 talks about the salary of nurses. According to the law, the minimum base pay of nurses working in the public health institutions shall not be lower than salary grade 15. Section 34 talks about the prohibitions in the practice of nursing. This section states that any person practicing nursing in the Philippines or within the meaning of the law, or both, without a certificate or a license, using another person's license, using an invalid, suspended, revoked, or expired license, submitting fake documents to the board, falsely appending the titles Bachelor of Science in Nursing and Registered Nurse, assisting the illegal practice of an unqualified person to practice nursing, must pay a fine of 50,000 pesos to 100,000 pesos, or 1 to 6 years of prison. That ends the part 8 and the last part of this lecture series. And here are the correct answers. That is the end of the RA 9173 Law lecture. See you on my next lecture series. Bye!